Good evening, everyone. Thank you for joining us tonight. My name is Joseph Fuchs. I'm the administrator for Bucks County Surgical Suites. Our facility here is in Warrenton, Pennsylvania. We're easily accessible right off of 611 and 202, just south of Doylestown and just north of Montgomery County. In January of this year, we began hosting our total joint replacement heal at home seminars right here in our lobby, and we had great success up until, as you are all aware, COVID hit. The COVID pandemic has forced many businesses to alter the way they do business a little bit, and in order to move forward, we have also done so. We are very pleased to be broadcasting live right here from the Comprehensive Orthopedic Center in Warrenton, Pennsylvania. And that is one of our changes here tonight. We are doing this via a Zoom call. So we're happy to have you here with us tonight, and we are also happy to have our surgeon partners from Bucks County Orthopedic Specialist, along with our practice manager from Fitness Physical Therapy, Dawn Campbell. We are thankful that you chose to spend some time with us, and we value your time. We know that your time is very important. I am confident that you will get some very useful information tonight about your total replacement surgery options. Along those lines, with some of the changes that we have made, as you will see when you come in the center, our staff, our physicians, everyone who is in the center will be wearing a mask during your visit. We would also ask that you do the same, and we do that in order to keep everyone safe. As I mentioned, we are extremely fortunate to have a full panel of orthopedic surgeons for you tonight. As our slide just went through, Dr. Charles Burrows, he is our main presenter, along with Dr. Thomas Vikoren, Dr. Douglas Boylan, and finally, Dr. Joshua Steere will be joining us. All of these gentlemen are specialists in total joint surgery replacement. At this time, I would like to go ahead and turn over the program. Actually, one note to make. We also have Judy Cody online with us. She is our IT technical support, and we would ask that if you have any questions, please go ahead and do so via the tab at the bottom, Q&A, not the chat tab. Use that Q&A tab at the bottom. All of your questions, we are going to do our best to answer all of your questions at our question and answer session a little bit later. Now, without further ado, I would like to go ahead and introduce our main presenter, Dr. Charles Burrows.
Joe, thank you very much for that wonderful introduction. As he mentioned, we're broadcasting from 2800 Kelly Road in Warrenton, Pennsylvania. We have built a comprehensive orthopedic center at this location. We are able to provide complete care for our joint replacement patients here, starting with orthopedic care, where you can meet with the orthopedic surgeons at the offices of Bucks County Orthopedic Specialists on the 3rd floor. You can have surgical care at Bucks County Surgical Suites on the 1st floor. And then we also have full physical therapy services available on the 3rd floor at Fitness Physical Therapy. Next slide. So this program has been nurtured for greater than 3 years. It became very apparent to us in 2017 and even before that patients were interested in a joint replacement program where they could avoid a hospitalization and recover at home. Patients were no longer interested in staying in hospitals and having prolonged stays to recover from joint replacement, but wanted a more personalized experience where they could have their surgery done, go home the same day, and then recover in a more comfortable environment at home. We began this program slowly and have grown it over the last 3+ years and have found excellent outcomes, enhanced safety, great patient satisfaction, and interestingly, lower costs for our patients and insurers. Next slide. This chart shows our journey that began in 2017. The Heal at Home program initially began with patients in a hospital environment at Doylestown Hospital. And these patients would come in, have a hip or knee replacement surgery performed, and then go home from the hospital the same day. And in 2017, 6 of these patients were done. Quickly, this program grew, and as we became more comfortable with performing outpatient joint replacement, and word of our program spread. In 2018, we had grown to 74 patients. In 2019, over 250 patients, and in 2020, well over 500 patients. And we're certainly anticipating crossing the 1,000 patient mark in 2021. Next slide. This schematic shows you what your personalized program or journey through joint replacement will look like. At 2800 Kelly Road, you can meet with one of these surgeons from Bucks County Orthopedic Specialists who can discuss your personal goals and decide if the Heal at Home outpatient joint replacement program is best for you. Next bullet. This picture is an outside view of our waiting room, and the next image shows the inside of the waiting room. As you can see, it is a clean, state-of-the-art facility. And one of the points I want to emphasize about our facility is it has been built with social distancing in mind. As you can see, it is spacious, patients are seated far apart, and all the patients and employees will wear masks throughout your entire patient experience. Next slide. The waiting rooms are large and individualized and allow for social distancing. And on the next slide, you can see we have full X-ray services available under one roof here at 2800 Kelly Road. Next slide. Some additional pictures show our personalized patient pods as well as exam rooms. Next slide. So once you've met with the surgeon, had your X-ray studies, and have decided that outpatient joint replacement is for you, your surgery will take place in our private facility on the first floor. You will be far away from any hospitalized patients, and you will not be in the presence of sick patients. The Bucks County Surgical Suites is designed for healthy patients. We do not take care of sick patients. We do not take care of infectious diseases in that facility. Next bullet. This video, which Joe Fuchs has done, will take you on a quick walk through Bucks County Surgical Suite so you can see what that facility looks like. Please start the video.
Hello, my name is Joe Fuchs. I am the administrator here at Bucks County Surgical Suites. We are pleased that you decided to join us for a tour. Let's get started. And once you come into Bucks County Surgical Suites, you'll check in right here at our front desk. One of our friendly staff members will be here to greet you. We're a small facility, only 8,000 square feet. This allows us to provide intimate care for you. We are a lot smaller than that large facility that you're used to, where you get lost in the shuffle. You're in the front door and you're out the back door, and we'll show you that with our tour. We have two large, modern operating rooms. Both are larger than 600 square feet. We are licensed by the Pennsylvania Department of Health, and we are nationally accredited by the Joint Commission. Our facility meets or exceeds all of those safety standards you would find in a hospital. And in this area, this is our preoperative and postoperative bay. You'll spend the majority of your time here at Bucks County Surgical Suites in one of these bays. So in addition to our 5 semi-private bays, we also have 2 private bays. Typically, you'll find a pediatric patient or somebody that needs some extra privacy or quiet in this room. Now, conveniently across from these bays is our nurses station. We have the friendliest nurses here, and they are waiting to take care of you. During physical therapy, which will be approximately the last hour of your stay, you'll do your physical therapy right here, and when it's time to go home, we will discharge you right out the back door with your family awaiting your arrival. We look forward to providing you exceptional care here at Bucks County Surgical Suites.
So as you can see, your surgery takes place at Bucks County Surgical Suites, and you will have your first physical therapy session in the recovery area. That physical therapist will then walk you out to your home, or out to your car, and then you'll go home. Upon arriving at home, you'll be met with home care visiting nurses, as well as physical therapists who will begin working with you in your home environment. Next bullet. This video was done by one of Thomas Vikoren's patients, and this just shows you the Heal at Home program. I'd like to let you know that this video was not done by us, but it was a video that the patient took and sent to one of his friends when he was encouraging him to consider joint replacement at Bucks County Surgical Suites. Please roll the video.
This is day one after my surgery.
Less than 24 hours.
Less than 24 hours. And as you can see, I'm on a walker. Because, well, hold on a second. So this is less than 24 hours after, sorry, I gotta put this on the ground, after surgery. And well, I'm on a cane, you know what, forget the cane. So technically, if you have the right physical therapy before you get your hip surgery, you know, you can do the cha-cha, see this? So before, seriously, yeah, it's an 8-inch incision right here. This is anterior. I didn't get it done at Rothman because I didn't want to waste the gas. Right here in Bucks County.
Is that posterior?
At the surgical center. Yeah, this is posterior, right. Anterior would have been here. It's up to you, Mike. Good luck.
So anyway, I don't know that we're advocating doing the cha-cha the day after surgery, but this illustrates what wonderful results we've gotten with patients in our outpatient surgery program. And many of our patients are at home walking around the following day after surgery, just like him. After that, you will receive physical therapy at home for possibly 2 or 3 days, and then you will transition back to our suites at 2800 Kelly Road, where you will go to fitness physical therapy, and you will receive hands-on, individualized physical therapy with our exceptional physical therapy team. They will work with you 2-3 times per week and ensure that your recovery is seamless. Also, for our patients that are in Doylestown Borough, we also have a satellite facility in Doylestown that may be more convenient for you to go to as well. Next slide. At this point, I'd like to turn our presentation over to Dawn Campbell. She's our practice manager and lead physical therapist, and she can walk you through what that part of the program looks like. Take it away, Dawn.
Hi, everyone. My name is Dawn Campbell. I am a physical therapist, and as Dr. Burrows stated, the manager of fitness physical therapy. And I would like to, again, just kind of give you a little overview as what to expect in your physical therapy process for your joint replacement. We highly encourage that you do receive some what we call prehab, which is a physical therapy visit with some home exercise program instructions prior to your surgery to maximize on your range of motion, maximize on your strength prior to having your surgery. Studies have shown that the stronger you are prior to your surgery, the more range of motion you have prior to your surgery, the easier the rehab process is post-surgery in your recovery. Now, the day of surgery, as they did go over, your physical therapist will meet with you a couple hours after your surgery to have you up and walking with a rolling walker. You will be taught how to go up and down a flight of stairs, how to rise to stand from sitting, as well as go from standing to sitting properly and safely, and as well as how to get in and out of a car safely. I know it all sounds a bit scary, just a few hours after surgery, but you will be surprised at how well you do and how easy it all flows. Then a couple days after your surgery, you will come to our outpatient facility. As you can see here, this is our new state-of-the-art facility, and you will have an evaluation by a physical therapist who will design a program specifically for you based on your needs and what we find during the evaluation to allow you to progress through and return to your active lifestyle as quickly and as safely as we can with great success. And you can see some more of our facility in these photos.
Well, thank you, Dawn. It's a great look at what our physical therapy here at Kelly Road looks like. I just want everybody to understand that what we've put together for you, our patients, is a completely coordinated experience. It's been a dream of ours to provide comprehensive, safe, world-class orthopedic care under one roof, and we have done that. You can come here and consult with one of our world-class orthopedic surgeons. You can receive pre-operative and post-operative physical therapy. And you can also have surgery performed in the same building in an excellent surgical center without the concerns of infectious disease. I hope you've enjoyed what you've seen so far. We certainly would like you to read a few testimonials that our patients have provided us. And the outcomes and outpouring of positive feedback has really been beyond our wildest dreams with respect to the Heal at Home program and all of the services we're offering here at Kelly Road. Now you're going to see an audience poll. The focus of this is we'd love to hear from you. By answering these questions, you can help us further direct the conversation now in terms of what your concerns are. And we will continue with the conversation and go through some questions and answers. So thank you very much so far, and here we go.
So the poll is up, and go ahead and start answering the questions. I'm seeing that most of you have voted. Go ahead and make your selection if you haven't done so just yet, and I'll give it another 5 seconds or so. Okay, going once, going twice, ending the poll here. Share the results. Hopefully everybody can see that. Dr. Burrows, any surprises?
No, not at all. I'd say that we clearly were expecting that most patients would be picking knee and hip replacement, and that's what the poll shows us. Clearly, for those of you that answered none of the above, I want to emphasize that Bucks County Orthopedic Specialists at Kelly Road has providers in all fields of orthopedics. We have sports medicine specialists, hand specialists, pediatric specialists, foot and ankle specialists, and really can cover all of your orthopedic needs. So if hip, knee, or shoulder replacement is not your concern, we certainly have other people that would be happy to talk to you.
So now we will move to the question and answer portion. We see that there are a number of questions already. So again, please type your questions in the Q&A box, and then we will go through it. Oh gosh, their first question was, how do I maximize the screen? I certainly hope that you've been able to figure it out. There should be a little box on the upper right that will allow you to maximize. The next question is, how do you handle out of network as compared to Doylestown Hospital? Somebody want to take a pass at that? How do you handle out of network as compared to Doylestown Hospital? I guess that might depend on the insurance specifically, but.
I can answer that, Judy. So the orthopedic practice and the surgical suites are in network with most major insurances, but for those that are not, we have a policy of accepting what the patient would have paid as an in-network rate as the payment for the procedure.
Thank you. Next question. I think this one's probably for Dawn. When will PT start? Will it be painful?
Well, PT actually, I recommend that you start your PT actually before you have your surgery. And then it will actually also continue the day that you have your surgery, continue with the home care PT. And then when you come into the outpatient facility, it usually is within 2 days after your surgery. Unfortunately, there is some discomfort with this, the therapy, but really it is the first couple weeks that are the hardest, and then you will be so surprised at how smoothly things will go from there and how well you will do.
Thank you. Next question. What is the total time span? Oops, I just lost that. Sorry, somebody typed it in and then it jumped. My apologies. What is the total time span from pre-op through final? Pre-op through final.
Judy, I'd be happy to answer that. I don't know if there's a specific time frame to tell you how long the whole process takes, but the vast majority of improvement occurs within weeks after the operation. But you will continue to improve with respect to strength and endurance for a year after the operation. In terms of common questions we get asked, most people are back to driving a car within weeks, and they're certainly back to walking within a day. In fact, the patients that are in our facility will be walking the same day around the facility and will be walking around their homes that evening. So it is a process. That there are certain milestones you'll meet. There are things that we'd be happy to talk to you about in the office, specifically with respect to work and other requirements you may have with your day-to-day life, but you will be getting back to life quickly after these operations.
Terrific. Here's another one for Dawn. How long is PT required for a knee replacement?
That can vary from person to person as far as the length of time. You know, we've had some people receive their therapy 2 to 3 times a week for 4 weeks. Some are 6 weeks, some are 8 weeks. A lot of it will depend on how compliant everyone is with their home program in combination with their outpatient therapy. And the more that we can work together, then hopefully your physical therapy will be more along the 4 to 6 weeks, but sometimes it can be a little longer.
Thank you. Do you perform newer, minimally invasive total knee replacement operations? Maybe Dr. Steere?
Sure, I'm happy to answer that. So we do partial knee replacements. That's less invasive surgery than a total knee replacement for patients that have arthritis in just one part of the knee as opposed to the entire knee. So that would be an option for you if that was your case.
Thank you. Here's another question. Do you perform newer, oh, I'm sorry, we just did that one. Why should I consider having a joint replacement at a surgery center rather than a hospital? Dr. Boylan, would you like to answer that one?
Sure, happy to. I think that I think it's patient preference, a lot of it. I think a lot of patients would find that the experience at the surgery center and going home is good, but you have to have somebody at home with you. So it's not a procedure for someone who's by themselves. It doesn't mean that you can't have someone come and visit or stay with you for a few days afterwards. I think the big thing here too is being out of the hospital, the infection rate is much lower, much lower. I can't say, I believe that we still have and I knock on wood when I say this, but we have a 0% infection rate at the surgical suites. So I think that that's important these days. I think that a lot of people don't want to be in a hospital setting. I think that if someone has a lot of anxiety about going home the same day, it might not be for them. But I think if you're a healthy person, there are some restrictions that are put on us as far as health, as far as who can have surgery at the surgery center. So even though you might be very excited to do that, there are some patients that just aren't able to be done there. But the majority of patients that are healthy and motivated and have somebody at home, I think would do very, very well at the surgical suites. But I do think it is a personal preference. And if you're someone who's very anxious about it, then it may not be for you. But I think the patients that I've had come here, I've asked them when the process has been done, if there was any problems, and all of my patients have found it to be a very great experience.
Thank you. Here's a related question. I'm worried about COVID. Should I put off my surgery?
Yeah, I'm happy to answer that, Judy. For those patients having a heel at home replacement, the check-in for the surgery at the joint replacement center occurs about an hour before the procedure. Most of the procedures are done with what's called a spinal anesthetic, where the legs are numbed, but the person's never placed on a breathing tube. So actually, even the patient in question having the procedure employs a mask throughout the whole procedure, which takes about an hour. After surgery, there's about 30 minutes waiting for the anesthetic to wear off before physical therapy starts. And then the physical therapy goes on for about an hour, hour and a half prior to the patient meeting the goals of distance walked, doing stairs immediately after the surgery, and safe discharge home. So the whole process door to door is about 3 or 4 hours, during which the patient encounters a far fewer number of people with a heel at home replacement than with a traditional inpatient hospital stay. So, and it should also be noted that during that time, the patient and the entirety of the staff have full protective equipment. So the exposure that one might have is very low. And I think patients should have confidence that they don't need to put off their replacement to have a safe joint replacement. Conversely, a lot of studies have shown that people who have arthritis that put it off suffer ill effects of the arthritis itself, such as gaining weight, worsening control of diabetes, lack of ability to get exercise, and issues such as depression. So I would advise people not to be scared, that the level of precautions in place and safety with a heel at home replacement is outstanding. And I would have full confidence, even for anyone in my own family, if they had needed it, to have the surgery in this manner.
Thank you. Don't put it off. Here's another question. Should I have one or both knees replaced at the same time? Somebody want to take that? Maybe if I may suggest, you guys go ahead and unmute yourselves so that you don't have to have that little pause and jump right in.
Sure, I'll answer, Judy. In a surgery center setting, we would only do a single joint replacement at a time. That being said, many of our patients who are undergoing joint replacement will undergo what's called staged joint replacement, which means we will do one replacement and then plan to do the next within weeks after the first. Personally, I think single or unilateral joint replacement is the way to go. I tell my patients it's 3 times more difficult to undergo a bilateral or both knees on the same day. Bilateral knee replacements are still traditionally done in the walls of a hospital and often require an inpatient stay in a rehab facility or skilled nursing facility afterwards. I think in today's world, with the concerns about COVID and infectious disease, I strongly feel that for the vast majority of patients, doing knee replacement one at a time is the best choice.
Thank you. Here's one for Dawn. What type of PT exercise is recommended before having the surgery?
The exercises that we often give will be those that work on strengthening of not only your thigh muscles, what we call your quadriceps and your hamstrings, but also working on hip strength and taking a whole body approach. Sometimes it even involves upper body strengthening because of the fact that you'll be using a walker and you'll be using a cane as well for hopefully a short time period, but just in case. So, there are a variety of exercises that we would give based on what the needs are of the patient that would address both hip strength, knee strength, ankle strength, and again, upper body as needed.
Thank you. Here's one that says, "Hi, Dr. Vikoren. Where is the incision for the hip? How do you make sure I don't have pain at home?"
So the incision for the hip is over the side. This is probably a good opportunity to address a common question people have is, what's better, the front incision or the side incision? And I tell my patients that the front incision, what's called anterior, was really came into some interest about 5 or 6 years ago. And a lot of studies have been done since that time. And unfortunately, those studies show that method conveys a higher complication rate. And so all of us in our practice use incision on the side with what's called a posterior approach with immediate weight bearing, not even an hour after surgery. So the side incision, in my opinion, is the safer approach and has a faster recovery. And there are a lot of studies recently that have documented that. Was there more to the question?
I how do you make sure I don't have pain at home?
Oh, okay. So the pain is probably the biggest question that people ask. How does pain manage? So pain is the biggest advancement in joint replacement surgery probably that has taken place to allow for same-day joint replacement. This involves the concept of pre-medication, which means actually blocking the pain even before your body feels it. So if you went to a rock concert and the music was blasting, you rode home in your car, your ears would be ringing. But if you went to a rock concert and you wore earplugs, so it never got to that level that it was so high, when you rode home in your car, there wouldn't be ringing in your ears. So we use techniques to actually pre-medicate and block the pain even prior to the surgery occurring. Then intraoperatively use injection of anesthetic agents around the replacement combined with some pretty advanced nerve blocks. Actually, I think behind Dr. Boylan are some of the machines that guide these advanced nerve blocks that help patients postoperatively. And then in addition, we use anti-inflammatory medications postoperatively. That's been a big advancement to make sure that people have a tolerable pain level. And nowadays you can actually read a lot about people sharing their experience online. And if you search for the Bucks County Surgical Suites, you'll see over 60 people have shared their experience having a go home the same day replacement. And you'll see all of them have said the pain was well controlled and they were happy with the experience. Thanks.
Perfect, thank you. Dawn, we're gonna really make you work tonight. For the post-op PT, will coordination of treatment and care remain intact if I choose a PT facility closer to home? The drive to your nice new facility would be about 20 to 25 minutes each way otherwise. Or I guess somebody else could also take that, but coordination of care.
I do think, it really becomes what's easiest for the patient. And certainly there are other facilities in the area that if the drive is a concern and you're relying on transportation of family or friends, that can be of concern. So sometimes that does happen. And certainly we do have a lot of patients that do come to our facility. They like the whole in-house approach of having it all done in one center. So having the surgery in one center, the doctors in one center, the PT in one center is certainly a plus. But certainly if transportation is an issue, there are other places closer to home that you could go to.
And the coordination will still be there.
Absolutely, absolutely.
Okay, thank you. Three-part question here. Does Dr. Cody operate here? Can I come with Medicare and Aetna as Plan B? And what are the cons as compared to the hospital? Maybe Joe, do you want to take that?
Absolutely. So yes, Dr. Cody does work here. He performs a lot of surgeries, just as I believe Dr. Burrows had mentioned in the presentation. We have a full staff of orthopedic surgeons who not only do total joint replacements, but sports medicine, ACL repairs, shoulder replacements, shoulder rotator cuff repairs, knee arthroscopies, ankles, pretty much anything that you would need. You can call the phone number at the end of this presentation and make an appointment to see any orthopedic surgeon. Dr. Cody, again, does operate here at the center. As far as Medicare and Aetna as a secondary, absolutely. As Dr. Vikoren, I believe, had mentioned earlier, with insurances, if there are any questions, we are in network with a lot of the insurers, as is Bucks County Orthopedic Specialist. But if there are any questions about your insurance, feel free to call our center here at 215-607-2100. And you can ask to speak with our office manager, who will help you along with any questions that you might have with your insurance.
Joe, can I add something to your answer? And
Absolutely.
that's also that because of the lower cost of a surgery center as compared with a hospital venue, a lot of the insurance companies incentivize patients with lower copays when they choose a surgery center for their procedure. And so Bucks County Surgical Suites is what's called Tier 1, which means that the insurance companies see it as the most cost-effective approach. And because of the lower complication rate, as Dr. Boylan mentioned, the low infection rate, for example, of a surgery center environment, they are very much enthusiastic about patients choosing venues like Bucks County Surgical Suites for surgery as compared with hospital environments.
Great. Here's an interesting one. How long do hip and knee replacements last?
I'll be happy to take that one. They're extremely durable. Years ago, we had grave concerns that they wouldn't last too long, but what we found is the vast majority of hip replacements are lasting 30 years. And in fact, some of the orthopedic companies are even talking about a quote lifetime hip replacement. Knee replacements, the vast majority of them are lasting 20 years or longer. So they are extremely durable, long lasting, and when performed properly, for many patients will give a lifetime of service.
Okay, thank you. How do you manage my pain? Who wants to take that one?
Dr. Steere, you want to answer that one?
Sure, absolutely. So to kind of piggyback off of what you mentioned with the nerve blocks, we take a multimodal approach. And so back in, as recently as a couple decades ago, everyone just got opioids and that was it. And so that we didn't work as well, and it led to a lot of other problems. Opioids in and of themselves, they're good for some initial surgical pain, but they do have side effects. And so what we've realized kind of as an orthopedic community, and certainly are implementing here at Bucks County Orthopedics and at the surgery suites, is when you take a multimodal approach and use multiple different types of pain medications, you have to use less of each one of them. And so you don't get into the dosing of having significant side effects. And so patients will the foundation of the pain relief once you're at home is going to be medications such as Tylenol combined with an anti-inflammatory if you're able to take an anti-inflammatory. And the combination of those two medications in studies of orthopedic patients is actually stronger than an opiate like Percocet. But a lot of our patients will take or have available to them something like oxycodone or a slightly lesser potent opioid-like medicine called tramadol. So the foundation are the non-opioid medications, and then in addition to that, using opiates. And that's once you're at home. Once you're at the surgery center, we do the nerve blocks and the spinal and local injections into the joint. So you really get the pain, we're kind of attacking the pain from multiple angles.
Perfect, thank you. Dr. Boylan, how do I know it's time to consider joint replacement?
It's a good question. I think it's personal to everyone. I try and tell patients that it's not just an X-ray, it's when your quality of life changes. So when you start realizing that you have to give up more and more, so if you're a runner and you've given up running and now you've given up tennis or hiking, the more that you have to give up because your knee bothers you too much or your hip bothers you too much, it can be as simple as, especially with hips, with getting shoes and socks on and having problems with just getting dressed at times. But when your joint gives you so much trouble that it's bothering you on a daily basis, then I think it's time to consider joint replacement. There's plenty of other things to do before that, which we talk about in the office, whether it's anti-inflammatories. There are a lot of people on anticoagulants right now that can't take anti-inflammatories. So that's kind of out of the question for them. So if they're on a blood thinner, that's one thing that isn't able to help them so much. Physical therapy can certainly be helpful to strengthen up around the joint. Weight loss can certainly be an issue, and trying to take some weight off the joint can be helpful. Modifying your activities can be helpful as well. But once again, once you start modifying too many of your activities, if you have pain at rest, if you have pain with activity, if you wake up at night because your joint's giving you some trouble, then it's probably time to consider joint replacement, as long as your x-rays and everything else lead us down that path to say that you have an arthritic joint. So it's different for everybody, but that's what I try and counsel patients when they're unhappy with their quality of life and what they're able to do, then chances are they would benefit from a joint replacement if x-rays and everything else works out and shows us that it's arthritic.
Thank you. Here's a slightly unusual question. Being a metallurgist, what material is preferred for a 65-year-old male knee replacement? Titanium or cobalt chrome? Who wants that one?
I'll answer that. So we use a very well-regarded replacement devices at the surgical suites made by Zimmer, which is the largest company with the best track record for its replacements. So that question hasn't come up before, but patients should rest assured that they're getting absolutely the highest quality replacement made. For the knee replacements made by Zimmer, the tibia bone piece is made of titanium, and the femur bone piece is a metal that's much like the alloy used in ball bearings. It's a stainless steel, cobalt chrome stainless steel that's polished to an extremely high polish so that the wear rate is negligible. And the hip replacements are typically all titanium, and oftentimes we use a ceramic ball, which has a lower wear rate than the metal ball.
Perfect. Here's a common question. How soon can I get back to driving after surgery?
That's a great question. Really, you have to think about which extremity is having the replacement. Assuming your car is an automatic transmission, patients who are having a left-sided hip or knee replacement generally are back to driving within a week to 2 weeks. A right-sided hip or knee replacement can take as long as 4 to 6 weeks. And it has to do with the physical shape the patient's in before the operation, as well as their participation in physical therapy after the operation.
This question is from somebody who asked a question earlier about PT, prehab PT, and she wants to hear specifically about prehab for knee replacement. Dawn?
Actually, when it comes to the exercises, there really is an overlap when you're talking about strengthening of the legs for both the hip, for both the knee. We would still be addressing hip strength and knee strength as well as ankle strength, because they all work together. It's this whole, what we would call a kinematic chain of everything kind of working together. So you need to make sure that the hips are strong for the knee as well as the hip being strong for the hip. So they all overlap. So the exercise will be very similar for both areas. And then there might be some that will be more specific for the hip or a little bit more specific for the knee. But in general, a lot of the exercises overlap and are the same.
Great, thank you. Here's another one. I like the idea of heal at home, but what do I do if I need help or have an emergency?
Well, the day of the surgery, a nurse is actually there upon arrival to your house, a registered nurse, and as well as a physical therapist, and they come again the next day. And I think of my heal at home patients as sort of my rock star patients that I really keep close coordination with. So I think patients should feel confident that this program has been in place for 3 years with many, many hundreds of patients and excellent results. So patients should have confidence that the program will be successful for them, and that the coordination between the nurses providing oversight at home and the surgeon is very tight.
Terrific. Here's an interesting question. Do you actually do my surgery, or do you have interns, residents, or trainees doing surgery?
I'll answer that. Here in our office, we don't have residents, we don't have trainees. We're the ones that do your surgery. We're the ones that are there when we make the incision. We're the ones that are there when the incision's closed. We do have a physician assistant with us in the case that acts as an assistant. They're the assistant. They're holding retractors so that we can visualize. They're very good. That's why surgery doesn't take very long. We can get you on and off the table rather quickly, which is important to a quick recovery as well. So it's us, we're there, and we do your surgery.
Great. Heal at home is presented as an option. What is the criteria for having to do the surgery at a hospital instead of heal at home?
I'll take that, Judy. For most patients, heal at home is appropriate, but there are some patients that may not be medically appropriate. Part of our process in getting you prepared for surgery involves a series of blood tests, EKG, and also a visit with your general internist or family doctor. We will have them help us with the appropriate decision-making if your medical condition is well enough for you to undergo an outpatient joint replacement at the surgical suites. Or if you have some medical problems or what we call comorbidities that may make a hospitalization more appropriate. But the vast majority of patients we're seeing in our office are appropriate for outpatient surgery.
Great. And here's kind of a related question. Are you still doing surgery at the hospital if the new location doesn't work for you?
Well, that ties into what we just said. We're still doing surgery at Doylestown Hospital. We never stopped doing surgery at Doylestown Hospital. It's not that the new location doesn't work out for you. We're going to just, in coordination with your care team, meaning your family doctors, internists, cardiologists, and other specialists, decide before surgery the most appropriate site. And I feel very confident that the people we work with have helped us to make those decisions appropriately over the last 3 years, and will continue to do so in the future.
Okay. I think this question, Dr. Steere answered a little bit, but another related question: following knee replacement, can pain generally be controlled without narcotics?
So I would say most patients end up using some sort of opioid, whether it's tramadol, which is opioid-like, or something like hydrocodone, which is what's in Vicodin, or oxycodone, which is what's in Percocet. I would say most patients in the first week or two will use something, but some don't. And if patients don't need it, we certainly encourage them to use the other medications as their primary source of pain control. Using the medications for a short period of time after a surgical procedure has much lower rates of long-term use and abuse than if you're taking it beforehand, for example, for a chronic pain issue. So I've had very few patients who've needed to continue opioid pain medications longer than a couple weeks.
Okay. And we're going around the circle and back to Dawn. Is the physical therapy site covered by insurance?
We do accept almost all insurances. So we are Medicare, a lot of your commercial plans. We also have the option, if we are not a provider with your insurance, and really the main one that we're not a provider is that the PT is not an HMO capitated facility. So if you have an HMO capitated plan, we do have the option of self-pay, in which you can opt to not go through your insurance and do a private pay instead for each session.
You know, Dawn, ironically, I just tell you boots on the ground feedback. I hear a lot of capitated patients tell me that that's actually less expensive doing that than it would be to go to their capitated site and pay the copay the capitated site charges.
That is true. A lot of the copays are higher on the capitated plans, and I find that the self-pay option works better for them.
Interesting. So there you have it. Here's one about exercising. Dr. Boylan, maybe you might want to take this. I'm worried that I won't be able to be as active as I am now after my knee replacement. So now I'm questioning if I should even get it done. Can I still work out at a high-level gym after my surgery?
Sure. I mean, if you're able to work out on a high level without any pain, then you probably don't need to have a joint replacement. But you know, if you're having issues and you're thinking about joint replacement because you can't do all the things that you want to do, getting back to and working out on a high level at a gym afterwards is fine. You know, we replace joints to get people back and be active and mobile and doing things. Are most people necessarily running after joint replacement? Maybe some of my colleagues' patients are, but I would tell you that most of my patients, you know, aren't running. Are they working out on an elliptical machine? Are they working out on an exercise bike, a bike outside? Are they hiking for long periods of time? Can they walk for 6 miles? I would say yes. You know, can you work out with weights at the gym following joint replacement? Yes, I think all those things are certainly attainable. I think that in order to have your joint replaced, if you're really questioning that are you going to be able to do it afterwards? If you're struggling to do it beforehand, then I think they're, you know, depending on x-rays, again, as I mentioned before, and what your joint looks like, and you're struggling to be able to do those things, then I think, having a consultation with one of us to discuss what the expectations are afterwards and what your expectations are of what you want to get back to specifically, I think are good. But I think that most patients are doing and having joint replacements so that they can have a better quality of life and be more active. And that's the reason to go ahead with the surgery.
Okay, terrific. Here's a question. I'm not sure if we'll know the specific answer, but who is the hip replacement specialist? I think you guys all are. Who has had the most replacements?
I'll answer that. I will start by saying I do not do hip replacement. So my other three colleagues do an excellent job with hip replacement. I've referred each of them different patients that have come and seen me for their hip. But I will say that I do knee replacement, but I do not do hip replacement. And if one of them want to claim to be the best hip surgeon out there, I won't keep them from it, but I think they're all excellent.
Okay, terrific. How long is preoperative PT?
As far as the prehab, I mean, you can, if you know that you're going to be having surgery, you could start it months ahead of time to even some people come in just a couple weeks prior to their surgery to get started on working on their strength and their range of motion. So some people plan it far ahead and sometimes it's just a couple weeks. So, no time is wasted. So as soon as you can get started on something, it will benefit you in the long run.
Okay, thanks. Here's one I think for Joe. Do I need to bring a rolling walker with me when I come for surgery?
That is a fantastic question. Yes, we will have you bring your own rolling walker and your single point cane. One of our physical therapists will size them for you to make sure that obviously they're the right size. And you will use that and then take that home with you when you leave the center to use at home. But yes, the answer to that is absolutely. Please bring your rolling walker and your single point cane.
Terrific.
And those items will be coordinated through our office when you schedule surgery. So you won't be told to go out and find these items. We'll make sure that it's seamless and that those items are provided for you as part of the process. That's
great. Do you perform cementless knee replacements? And if not, why? Cementless knee replacements.
Sure, I'm happy to answer that. We all do cemented knee replacements. The track record of cemented knee replacements is slightly superior to cementless knee replacements. So basically, cementless technology has been evolving, but it's not still at this point not quite as good in the medical literature track record wise.
Right. Yeah. Evidence-based medicine. That's
Correct.
Great. Do I need to take a COVID test before my surgery? Joe, if you want to take that one.
So currently we are not requiring a COVID test for all patients. However, based on your anesthesia, you may be required to have a COVID test. And that would be something that the office, the physicians would discuss with you during your consultation. Everybody is pre-screened prior to coming into the center. The temperatures are taken as we spoke about earlier. Everybody does wear a mask pretty much the entire time that you're in the center. But as far as COVID testing, and this is again an evolving situation, the answer today may not be the answer tomorrow. We may change to mandating COVID tests for everybody, but as of right now, pre-screening, temperature checks, and again, based on your anesthesia and your consultation with your physician, that's the answer that we would come up with.
Right, we continuously monitor those guidances. Can you be asleep for surgery? There's another question.
So
I'll answer that for, okay, go ahead, Dr. Boylan.
So most of our patients, as someone else mentioned, usually get a spinal anesthetic. We find that patients do well that way. They are not usually as nauseous. They come around much quicker and don't usually have as much pain as well. And so, but patients are generally sedated, so they do receive some medicine through the IV. So you're not actually hearing us work. You're not hearing anything that's happening while you're there. And so you're not fully asleep, but you're not kind of aware of the surgery going on while it's happening.
Okay. Here's a more specific question to what are the relative risks of leg shortening following knee replacement? Anybody have a perspective on that one?
Sure, I'd be able to handle that one. Really, leg length discrepancies after knee replacement are very unusual. The ligaments on the outer and inner aspect of the knee, or what are called the collateral ligaments, are involved in the balance of a knee replacement. And in other words, if a knee is made too short, the knee replacement will seem loose, and if it's made too long, it'll be too tight. So the ligaments guide the length of the knee replacement that we do. So I'd say knee replacement leg length discrepancies are extremely rare in the hands of the surgeons of this panel.
Dawn, how far in advance of surgery should one start pre-op PT? I think we had a question similar to that, but.
Yeah, we did. And like, as I stated earlier, sometimes people start, a couple months, or they know that they're going to be having surgery. So they start some prehab, getting some home exercises, and some might be just a couple weeks prior to the surgery. Getting moving, working on your range of motion, your strength at any time before that surgery, and certainly continuing it post, all benefits you in the long run. So as early as you can, but even if it's just a couple weeks, it's still helpful.
Great. How long does a knee replacement take? Dr. Steere, would you like to answer that one?
Sure, be happy to. So knee replacements typically take about an hour. And so it depends a little bit on how many, bone spurs are on the knee and what needs to be done. But in general, it takes about an hour to do. There's some time beforehand getting the spinal anesthesia, and there's some time afterwards closing up the incision with the sutures and waking up and getting the dressings on. So it's a little bit like going to the airport. There's a lot of time on the front end and back end. But at the Bucks County Surgical Suites, we try to make that as seamless as possible. So the surgery time is an hour, and we get you working with a therapist right away afterwards.
Okay, thank you. If you have a replacement and are working, when do you go back to work after surgery?
I can answer that one too. I would say that depends a lot on what the job is. And so people who are laborers or on their feet a lot, hostesses, wait staff, things like that, it depends on the patient and how quickly they're recovering. So I would say for someone who's on their feet throughout their job, I would say 4 weeks at least, sometimes up to 6 weeks. But again, it kind of depends on the individual. For people who are mostly working at a desk or not having to stand, or if they can accommodate sitting, then really it's based on whenever you're feeling up for it. And one thing that takes some time to recover is your kind of intellectual stamina. If you're healing from surgery, you're doing therapy, your intellectual stamina, looking at spreadsheets and thinking at a high level for 8 hours, 10 hours that's going to take some time to recover. But we're very flexible in terms of what people need and want to do as far as work goes, and we make it individualized.
Great, thank you. We're coming up to the top of the hour. Maybe we can get just one or two more. Here's one. What can be expected with respect to swelling of the leg post-surgery at home? Anyone want to take that one? Swelling of the leg post-surgery at home.
So I was having a conversation with one of our therapists in our break room. That's one of the benefits of here, is that we share a break room with our therapists. And so we talk about patients when we're, between our morning and afternoon sessions. And, it's interesting. I've had some patients who have a lot of swelling and some people have very little. And I think it's based on that inflammatory response that can happen after surgery. It's part of the healing response. We take a lot of steps to try to minimize that inflammatory response with all the nerve blocks in the spinal to kind of block that inflammatory cascade using the anti-inflammatory medications if they're safe. Ice is, as simple as it sounds, is one of the most important things. Icing the leg and elevating it helps what happens with the swelling is as you're healing, all the blood vessels dilate. The body's shunting a lot of blood flow to the leg to kind of bring the blood nutrients to heal. And that leads to the swelling. And the swelling isn't dangerous, but it can be problematic if it makes the leg stiff or heavy. And so we really encourage patients right away to be icing the knee. We have some devices that make it easier to keep the knee cool and elevating it. And also kind of monitoring your activity level. You know, after a knee replacement, for example, the most important early step is to get the range of motion back, and then gradually adding in the strengthening and endurance exercises. Some people do too well in a sense that they're walking and running errands, and then if they're still in that healing phase, it can lead to some swelling. So we caution people about that, but there's a lot of ways to help prevent the swelling.
Thank you. We are right at the top of the hour here, but we have one more question I want to make sure we get if possible, because I think this is important. Are there any special considerations for diabetics? If anybody can quickly answer that one.
Well, just as Dr. Burrows said, it's a very coordinated program. So when patients schedule a surgery, we definitely would take the advice of their primary care physician, and also involve the anesthesiologist to determine what time of day would be best for the procedure, monitoring blood sugar during the procedure. Actually, the surgery suites is a particularly good venue for diabetic because diabetics are known to be at higher risk for surgical site infection. And because the surgical suites and heal at home based surgeries where you're not in a hospital venue have a much lower infection rate, it's actually a better place to be.
Great to know. Well, thank you, everyone. I'm sorry if we were not able to get to all of your questions, but I will turn it back over to Joe right now to wrap us up.
Thank you, Judy. I appreciate you leading all of those questions. I do see that there was, I think there's 57 more questions and answers that are on there on that tab. So I would encourage all of our viewers that if you do have further questions, please call the number that is up on your screen, 215-348-7000. You can book your consultation with one of these surgeons at that number, Bucks County Orthopedic Specialist. I would like to thank all of our panelists. I think your answers were wonderful. I think we did gain a lot of insight as far as total joint replacement surgeries go. And I thank you all for your time, all of our surgeon panelists and Dawn from physical therapy. Again, thank you all for joining us this evening. We value your time. I hope you come away with some great information from this evening, and hopefully we will see you soon if you need that care. And if not, we wish you the best of health. So thank you again and have a wonderful evening. Stay safe, everyone.
Thanks, Joe.
Thanks,
and one
Joe.
more thing, Judy, thanks for all your technical support and helping our program go very smoothly tonight. You did a wonderful job for all of us. We really appreciate it.
Thank you, Judy.
Thank you.